Good morning to everyone and welcome to our first meeting in 2021. I hope we're approaching this year with a lot of hope and a lot of healing. We're going to start this meeting and you can join me virtually in a pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I think it's important that as we begin again, we really do think about our country and all the issues that we're facing. And as I said, I'm approaching it with real hope. I think we have a new beginning. And I'm excited, particularly for the League of Women Voters and to all the people that are working to make this a good organization. Right now, I don't know, I hope we have some new members. We've had it fast is great during this whole time of COVID. We've had quite a few new members to the League. So if you're a new member, just give us a signal by waving and saying hi. And hopefully sometime in the near future, we're going to be able to actually welcome you in a better way than this. But thank you for joining us. I know that we have some guests today because we have such an important topic that I'm sure we're all really, really concerned about. Fortunately, it seems like Moore County is on the ball. We're hoping that they're moving quickly and will get us vaccinated and move forward. So right now, let me introduce Peggy Crawford, who will introduce our program for today. Peggy. Peggy, unmute.
I am unmuted. Welcome, everyone, and good morning. Today we are privileged to have a panel of 3 local experts in various areas of healthcare, each with unique experiences and expertise. We're very grateful to them for taking their time during this pressure COVID time to share with us. Each one is going to speak for about 10 minutes, and then all will be available to answer questions that you put in the chat box. The only thing you can't ask is, when will I get the vaccine? Because they have no idea either. So anyway, Mr. Price is going to go first. And Tony is the CEO of the Moore Free and Charitable Care Clinic. He also, and I think Mary Lou is on the board of that, right? Too. Yeah. He also serves on the board of directors of the Moore County Department of Health. Tony graduated from Virginia Tech in political science and urban planning, and later studied marketing at George Mason University. He is owner and principal consultant for the Quantum Technologies Consulting, and he was recently elected chair of the board of the North Carolina Association of Free and Charitable Clinics, and he's received many local and state recognitions for his significant work. He's going to talk a little bit about vulnerable and underserved populations and the effect of COVID, and the role of the Board of Health in prioritizing the vaccines and immunizations. So, Tony, and if you'll push speaker share, you'll be able to see him on your full screen.
Okay, thank you, Peggy. I appreciate it.
Yes.
Well, good morning, all, and thanks for giving me the opportunity to share how Moore Free and Charitable Clinic is managing given this COVID epidemic that we're in. As you know, we are a free and charitable clinic that serves the limited income uninsured of Moore County. The clinic is a 6,500 square foot facility and has 5 exam rooms, a pharmacy, and full-time clinical and administrative staff, which is also augmented by volunteers. We see somewhere in the neighborhood of 40 to 60 patients daily. We have a strong partnership with First Health, Pioneers Medical, Pioneer Surgical, and other medical facilities for specialty care and referral services. We have about 1,500 patients, most of which are chronically ill and have diabetes, heart disease, COPD, and other illnesses. And 60% of those folks are actually below poverty level. When COVID became prominent in March 2020, our goal was to stay open. We could not forsake our patients and close. And I will tell you that there were several clinics throughout the state that I'm part of that network that had to close their doors. But we wanted to continue to treat our patients as normal while providing COVID-19 guidance and education. Our first thought was, how do we keep our patients and staff safe and healthy as we navigate this virus? What physical changes do we make to the clinic to make sure we can stay safe? Are we going to test our patients? And if not, where do they get the testing? If a patient tests positive, what is our responsibility to monitor and track the patient's quarantine? Given the large portion of our patients that live in a multi-unit environment, how do we coach the patients so that they keep themselves safe if they're positive and not spread the virus? These questions, of course, were endless, and we weren't sure quite where to turn. I mean, everybody had questions. With our partners, First Health and also the Moore County Department of Health, the testing issue was resolved. They both set up testing sites and we were sending our patients there. We would provide our patients with a letter requesting a test, and the tests were done and results were provided to the patient as well as the clinic. With the assistance of the CARES funding, if some of you are familiar with CARES funding that came out of the federal government, through the state, the county, and also the North Carolina Association of Free and Charitable Clinics, we were able to make some changes in our clinic that kept us safe. One of the things that we first did is we tried to figure out how do we keep our patients outside the clinic without coming in and infecting others if they were positive. So we made some changes, and we started to monitor our patients by two-way audio and video. So we put a system in place where the patient would come to the front door. They would get the battery of questions as to whether or not they'd been exposed or not. And if they did not have any of the symptoms, we would allow them in. If they had the symptoms, we would keep them outside, have them return to their car, and call us on the phone. We would then prepare a letter for them to go get tested, and then the test results would come back to us. We also employed telehealth. We started seeing patients through a televideo system that was provided through an relationship that I have with the North Carolina Association of Free and Charitable Clinics. We installed sneeze guards. We took all of the reading material and whatnot out of the patient area. We installed TV monitors that allows patients to get COVID-19 information and other healthcare information while they were sitting in the waiting room for an appointment or to pick up medication. We facilitated a drive-through flu clinic. We bought 2 large tents, and we had a drive-through flu clinic where we provided about 550 vaccinations for our patients. Unfortunately, we didn't do them all because there was quite a bit of concern out there about taking flu vaccine as well as the COVID-19 vaccine. So some folks just decided they wouldn't participate. Most of all, what we wanted to do is to make sure that we kept our patients and our staff safe. So through a lot of vigilance and personal and professional responsibility, we used PPE and we kept our staff safe. And knock on wood, to date, we have not had any staff off from work because of a positive case. We did have one situation where one of our staff thought they were exposed by one of their relatives, and they were off for about 7 days. But other than that, we have all stayed safe. As for COVID patient metrics, so far we've sent 381 folks for testing. 91 of them tested positive, and we've had 3 deaths So that works out to be about 24% positive test rate for the ones that we've sent, which is pretty high. I also was asked to speak about the reporting for the Board of Health. There has been several articles in the newspaper about the timing of the Board of Health reporting a death versus the press reporting. And I don't want to speak a whole lot about it. I think it is getting resolved, but I think it's just a matter of timing. Quite frankly, when a death certificate is signed off by the Department of Health, it has to go to the state before it's actually confirmed of the type of death and the person that died. And then it comes back to the county and then it's reported officially. So it's a matter of timing because in a lot of cases, the press will get the report of a death before we can get the official word back from the state. So I think there is a compromise being worked out, and I think that you'll see in the future more timely reporting. So that's my opening comments. I'll be here for questions as you have them, but at this point, I will turn it over to Ms. Lee or Dr. Watt.
Okay. Thank you very much.
You're welcome.
And we also, could you comment, Tony, just before you leave about the effect on vulnerable and populations, and has it been in Moore County like it has been otherwise in the United States where they've been more acutely affected?
Well, as I reported, our positive test rate was about 24%, but I can tell you that in this county right now, and I'm sure Jane will give you, better numbers on it, but the test positive rate is high throughout the county. The one thing that we have seen from our population is that a lot of them live in multi-family units. So they'll have a household where there's 3 or 4 different families. And in those cases, we have seen that the positive test rate increase quite a bit because some of these folks have to go to work. They weren't able to stop working and receive payment at home or whatever. They had to go to work. So if they were a landscaper or something in the services industry, they went to work. They ended up getting affected. They came back home and affected, some portions of the household. So I think that's one of the areas. I can't really speak on the death rate, but I from just what I hear, I would suggest that perhaps the death rate was a little higher as related to persons that were financially disadvantaged or whatever. But I'd say for the most part, COVID didn't really differentiate. It hit all of us. And so we've just tried to keep our folks educated as much as we could, make sure they understand how to keep themselves quarantined. And once, if they weren't positive, wearing their mask, we went out and purchased masks that we gave to our patients. We also had a lot of support from the community, different quilting guilds and whatnot that supported us and provided masks. So I think we've done just about as good as you can given a virus that's been somewhat out of control.
Thank you. Thank you so much. Next, we're going to hear from Dr. Robert Watt. He is an internal medicine specialist in immunochemist at First Health with over 26 years of experience in the medical field. He graduated from Indiana University School of Medicine and did his residency in internal medicine at St. Vincent's Hospital and Healthcare Center. He spoke to our league last May, just about when we were learning about COVID, and did an excellent job. And we are delighted to have him back to focus this time on vaccine research and also on the new variants and, to say some things about that. So Dr. Watt.
Thank you very much. Can you hear me okay, guys? I'm going to share my screen with you, okay? Can you see this slide, guys?
Try again, Rob.
Okay.
I just enabled it. Yeah, we can see it now. Thank you.
Okay. Well, thank you very much for the kind introduction. I want to start by saying this slide basically is a cartoon that we need to spend just a little bit of time on to understand both the vaccines and the variants. Okay. So all the vaccines to date, someone asked me, I had a question in the chat about what the vaccines do and they don't do. All the current vaccines that are available and the two that are likely to become available soon, which I'll get to, allow us to make antibodies to the so-called spike protein that is the point where the virus attaches to receptors on the cell surface of human cells. So I'm going to get to the variant. So when we talk about a variant, we're talking about variants in this spike protein. That's what all the variants that have been discussed and described, which I'll get to, have to do with variation in this one protein. This virus makes 29 proteins. The one that the vaccines are targeted to and the variants that have been described are variations in just one protein, the most important protein in terms of infectivity. So that's kind of a key thing to understand, that we're talking about with the vaccines making antibodies to this spike protein. Why? Because this is the protein that interacts with human, usually alveolar cells and cells in the nasal passage, and causes the infectivity to start. So that's kind of a key point. Okay, let me see if I can get the next slide up here. Hold on. So here's the next slide. This is a slide that I got from the New York Times on Sunday or Saturday, and it talks about the current vaccine trials. 165 vaccines are thought to be in development throughout the world. You can see that only two, where's my cursor? Only two have been approved, and those are the Pfizer vaccine and the Moderna vaccine. There are two additional vaccines that likely will be approved, we think maybe next month. Those are vaccines from Johnson & Johnson and from AstraZeneca, and I'll talk about those in a second. So the current vaccines, let me just stop my discussion for a second. Anybody who would like to get more information about these papers, you notice that these two papers that I have are NEJM, New England Journal of Medicine. And if you type in your computer, www.nejm.org, all the COVID-19 patients, all the COVID-19 papers that the New England Journal has published are available free. You don't need a subscription. You can actually read them for free. They also have essentially a podcast once a week, usually on Wednesdays, where they talk about current topics in COVID-19, which you can listen to for free. So at www.nejm.org. Here's a few comments about the current vaccines that have been approved in the United States, the Pfizer and Moderna vaccines. They are both mRNA vaccines. And the idea then is that the vaccine, which allows a messenger RNA for that spike protein to go into your cells, and then you make antibodies. So let me repeat that again. So we're trying to make antibodies to that spike protein. There's a lot of ways you can do it, which I don't have time to talk about. These two vaccines use a new technology where the RNA that codes for that spike protein gets implanted into your cells. The protein is then made, and your body responds to that protein. And both of these vaccines, it's very interesting, and I haven't got my cursor working, but if you get to the final dot on each one, it's not, they have actually constructed this messenger RNA and altered it for stability reasons. And so if you look at under Pfizer, it was approved, it was in phase 1 in March, and then it was approved December the 11th. There are 2 doses that are 21 days apart. It's an mRNA vaccine that is about 95% effective. And the RNA codes for a spike protein that's been stabilized by 2 proline additions. That's way more biochemistry than most people want to know about. But I'm saying, we are in a war with this virus. And the virologists, biochemists, and molecular biologists who've been on this from basically January, when the sequence was published, January 10th, the Chinese published the RNA sequence. And since that date, our virologists all over the world and molecular biologists have been studying this virus and have come up, at least Pfizer and Moderna, with these 2 constructs to try to make the most effective vaccine that we can possibly have. I'm going to go to the next slide. There are 2 other vaccines that probably will be approved in the United States in February, one by Johnson & Johnson, one by AstraZeneca. These vaccines do not use the messenger RNA technology. What they do is they encapsulate DNA into an adenovirus. So let me explain what that is. The common cold in many cases is caused by an adenovirus. So we know that the adenovirus is a common pathogen. Johnson & Johnson and AstraZeneca chose adenoviruses, which are not very common, but which they knew would get picked up by our cells. And in that adenovirus, which has been neutralized, so it can't replicate, is the information to code for the spike protein, just like the Moderna and Pfizer. So we're making spike protein in your bodies, and your immune system is responding to it, both with antibodies. As you can see, neutralizing antibodies have been seen with just 1 shot of the Johnson & Johnson after 1 injection. And after the second dose, the antibody titer goes up and the CD4 count, so you make a cellular immune response just after 1 dose. So these 2 vaccines will likely go prime time in the US in February. As you can see, the AstraZeneca vaccine is already approved in a number of countries, including UK. The United Kingdom approved the AstraZeneca vaccine in December 30th. It's also approved for use in India, Argentina, Mexico, Brazil, Pakistan, etc. The advantage of these 2 vaccines is they are stable in the refrigerator for up to 6 months. So no minus 90 freezer, no stability issues that we know of. And that is why, in large measure, India, Mexico, Brazil, Pakistan, et cetera, have approved this vaccine because of distribution reasons in those countries. Okay, I'm going to move on to the variant. Now, I want to correct one thing. These variants are not particularly new. They may be new in the news, but they're not new among physicians and scientists. In fact, the UK variant was discovered back in February. So the variants are becoming more popular in the common press, but they've been around. So let me go down this slide. When we talk about the variants, we're talking about variants in that spike protein, okay? We're talking about alterations in the amino acid sequence, the sequence of that spike protein. So let's go through. As of January 15th, 15 states in the US have identified the variants according to the CDC website, which I looked at. There are multiple variants that are circulating globally. Here's a few examples. The best known variant is the UK variant, which goes by various names, detected in September 2020 in the US, but retrospectively found in China in January and in Europe in February. So this variant's been out there. What does this variant have? It has several substitutions, but the key substitution in this variant is that an amino acid, aspartic acid, has been substituted with by glycine at position 614. So they actually know what amino acid has been changed in this variant. And I'm going to show you in my last slide what that does for infectivity. There's another variant discovered in Durban, South Africa. identified in October. It just hit the news here maybe recently, but it was identified in October. There's a Brazilian variant that's been found in travelers from Brazil. And I'm not going to, there's a variety of mechanisms how these variants are produced, but they all involve the spike protein, and they all involve the affinity, or how tightly the spike protein binds to the cell membrane that I showed in that first cartoon. So if that virus binds to the spike protein very, very, very tightly, infectivity will go up, okay? Let me just show you what that means. This is a tremendous paper, and I have it in my hand right here, okay? This was published December 31st. This, I think, tells you, in a way, why we're worried about these variants. But there's a hopeful message at the end, okay? So this paper, which is a 4-page paper, which you can download at nejm.org, reviews the wild type, sometimes called European, sometimes called Italian strain, versus the UK variant, the one that has been studied the most commonly. They did 3 studies, which were very, very interesting. What they did was they took tissue culture cells, live hamsters, and performed the following study. They took the wild type variant, the original variant, and mixed it either 1-to-1, 3-to-1, or 9-to-1 with the variant, both in tissue culture cells and hamsters. And guess what? The variant outcompeted the wild type, even when there was 9 parts normal strain and 1 part variant. An incredibly scary idea, right? That if you mix the normal strain 9 times more virus with just 1 part, the variant outcompetes the wild type strain. Now that has sent shivers across the world, okay? And that largely is probably why we have a surge in the United States right now. It's not just that people went home to visit grandma for Thanksgiving or Christmas, which we certainly have seen in the hospital, I can tell you that. But it's that this wild type strain now has a competitor out there, and probably more than one competitor. And this particular strain, the best studied to date, the UK strain, looks like it's about 10 times more effective. So that's troubling. However, the next dot, convalescent plasma from patients infected with the wild type strain neutralized both of these viruses. So the conclusion is that the variant binds tighter to the receptor, but neutralizing antibodies to the wild type will inhibit it. That's very good news. Why? Because all the vaccines, the Johnson & Johnson and AstraZeneca, as well as the Pfizer Moderna, which we have available today, are all made to that original sequence from Wuhan, January 10th. So here's the implication. The implication is that variants will cause more infections. That will result in more hospitalized patients, but not necessarily sicker patients. Vaccine should play a big role as plasma neutralizes the UK variant. And if we discover a variant that the current vaccines do not neutralize, then we will be into a much more serious situation. That's about all I got. I think I've taken about 10 minutes. There was a couple of questions on the chat room that I hope I address. Someone asked me about how does the vaccine work. I hope we covered that. Also, there was a question about various frontline doctors groups and other groups in the United States. And I can tell you that I don't think I'm speaking out of turn for my colleagues at First Health. We have a committee that looks at guidelines, and we meet about every 2 or 3 weeks. The guidelines that we use at First Health, I'm not speaking as for First Health, I'm speaking as a frontline doctor at First Health, are very similar to Mayo, Cleveland Clinic, and Mass General guidelines. We really follow the international studies very carefully. So
Rob, one of the other questions in the chat was about mask wearing and
Yes.
should you double mask or what kind of mask you should wear. Would you like to address that?
Yes, I would. I can tell you that I personally wear a KN95 mask, that are available online. I actually bought mine from a company called MyMedic, and I wear those outside when I'm outside going to the grocery store, and I wear them in the hospital unless I know I'm going into a COVID patient's room, which I do very frequently. And then I wear an N95 mask and use PPE, et cetera, et cetera, et cetera. So I would recommend, if you said, I would not wear a KN95 mask into a known COVID patient's room, but I certainly would wear a KN95 mask when I'm making rounds, et cetera.
Okay.
As long as it's not a known COVID patient. If it's a known COVID patient, everybody at the hospital wears an N95 mask. Oh, yeah, my wife just said, where do you get KN95 masks? If you just type in KN95 mask, you'll get a bunch of hits in Google. There are some stores locally that sell them. I think I've seen them at Staples, for example. I'm sure that a lot of pharmacies have them. So that's what I would do.
Okay,
Oh.
one other chat question directly to you was hydroxychloroquine. Would you use it? Would you prescribe? Would you like to answer that one?
Yeah, I can tell you that is still an incredibly hot button item. If you get on PubMed.gov, there's over 100 articles on hydroxychloroquine. So PubMed.gov, I think there was 108 when I looked over the weekend. The answer right now is no. And the reason I would say no is that all of the bodies I just mentioned, Mayo Clinic, Cleveland Clinic, Mass General, CDC, and FDA, at this moment, do not recommend using hydroxychloroquine outside a clinical trial, largely because of cardiac side effects. Highly contested, not agreed by every physician that I know, a subject of conversation in the physician's lounge almost every day. But I personally am not convinced with the data. There is a large trial called HERO HCQ, Hero Hydroxychloroquine, which is supposed to be coming out soon, and it may change the opinion of the FDA, the CDC, and Mayo and Cleveland Clinic, et cetera. But that would be my response right now.
Okay, thank you.
Thank you.
Tina Ganis just said that the KN95 masks are available at Health Innovations in Pinehurst.
There you go.
Thank you.
Thank you, Rob, so much.
Sure.
Wonderful, wonderful. You take what's incredibly complex and boil it down to what we can almost understand. So
Thank you.
Thank you very much. Our third speaker today is Jane Lee, who is Director of Infection Control and Patient Safety at First Health. Jane holds a BA in nursing from Barton College and a master's in public health nursing from UNC Chapel Hill. She is certified in infection control and is a fellow in the Association of Professionals in Infection Control. Jane has worked in infection control and prevention for 28 years, 23 of them at First Health. So Jane is going to talk about the role of First Health, maybe in the rollout of the prioritizing vaccines and kind of other things that she thinks we need covering.
Okay, can everybody hear me okay?
Yeah.
Yes.
All right, thank you. So the first thing I wanted to do is just to tell you a little bit about where we are with our COVID cases in Moore County and surrounding counties. We are classified by the state as critical community spread right now. We are in the red. If you go to DHHS and look at their map of the state and the different counties, all of our counties in our service area, First Health and Moore County, are in that critical red area, which means that we do have a lot of community spread. We do have a high percentage rate, and we are overcrowded in the hospital and are at critical levels at our hospital. For the state, we are about at about a 10% positivity rate. Here at the hospital through First Health, we do testing for Moore, Richmond, Montgomery, Hoke, Lee, and Randolph County. That's where we have clinics, the hospitals or convenient cares that are doing testing. Our overall percentage rate of positives is at 23%. So ours is higher than across the than what you see for the state, but that's because most everybody we test is symptomatic, has a reason for being tested. So you're going to see a higher positivity rate. But we are, continuing to see a lot of positives. We do have a lot of patients in-house. Dr. Watt can certainly attribute to that. He is on the front line taking care of those. And it is a very busy time, and we are very busy. As part of our initiatives, we've worked very closely with the health department and all of the counties to track the positive cases, to do follow-up, and to really promote prevention through the 3 W's, which is wear your mask, wait 6 feet apart, and wash your hands. And so we've really worked hard to try to get that word out, tried to work in our community to do that. In the last month, our initiatives have now changed to vaccines, both for the health departments and for the hospital. And so we are trying to improve our vaccination numbers, and hopefully that will slow the spread of this virus. So First Health has administered to date almost 6,000 vaccines. We started the week before Christmas is when we received our first shipment, and we started right away with vaccinating our frontline healthcare workers. We did start initially with those on the COVID units and doing direct COVID care, and then we spread out into other areas of our First Health providers and staff, and then also we are vaccinating our community providers and staff. We did work closely with the health department to divide up who had what area. The health department handled the dental clinics, funeral home, mortician staff, and the EMS personnel. And we handled our First Health staff and our local providers like PMC, PSC. So we've been very busy with that. Of course, it did happen right during the holidays. So we were, there were some delays. So you hear about like, why aren't the vaccines being given quicker, and why isn't this getting out? And part of it is, it arrived the week of Christmas. We were literally giving vaccines on the 23rd and 24th of December and things like that, trying to get this out. We've recently started vaccinating our population that is 75 and older. Again, we've worked closely with the health departments to do that and to determine how to disseminate that vaccine. So what we decided to do was partner with Pinehurst Medical Clinic initially, and we have started vaccination clinics for our 75 and older population who have either a First Health physician, a Pinehurst medical physician, and now we're spreading into some of the other practice settings. We are giving those vaccines by appointment only at the Fair Barn. We did work very closely with the Village of Pinehurst, and they've been very cooperative with giving us the Fair Barn, because that was the largest facility with the best flow that we were able to come up with in Moore County for those vaccinations. But we did feel it was important for people to have a vaccine, to be pre-registered, to make this process go smoothly, so the wait times would not be like you're hearing from other counties. I also felt very strongly that we don't want to do it in the car. That may come about later, but right now, with this being an emergency use authorization, there's still some things about this vaccine we don't know. We weren't sure about side effects, reactions, things like that. I felt very strongly that we needed to watch those that we were giving it to. So we do actually require that everybody wait for 15 minutes after receiving their vaccine before they are allowed to leave. So we bring them into the fair barn, and there is a waiting area where they can sit in there and be monitored during that time. Here at the hospital, we have now started also our second doses. Several of us who received our vaccines early on have gotten both doses. The thought is that within 2 weeks after your second dose, you should have 90 to 95% effectiveness of the vaccine to cover that. So Dr. White and I are certainly hoping that's true, because we're getting really close to that. We're almost there. Yeah.
We're almost there, Jane.
Almost there. So we have worked, we're still trying to get this distributed and doing the best we can. So what are some of the problems that we're having? Well, first of all is vaccine availability. It is allocated from the state to us. We can't just call up a number and say, send us so much vaccine. We have to work with the state for them to allocate that to us. Here at First Health, we were very fortunate that we do have one of those sub-zero chillibrators, as I call them, one of the high-level freezers. So we were able to get the Pfizer vaccine. We were able to get that in, and we were able to begin administering that as soon as it was available. But it is a process. The vaccine is preservative-free, which I think is really important. Because a lot of people that have reactions, we have reactions to the preservatives that are in vaccines. But the way that they prepare it is in the Pfizer vaccine, there are 5 doses in a vial. The vial comes in a powder form and has to be diluted. So it has to be defrosted, then it has to be diluted, then it has to be shook 5 times just in a certain way so that, and then it has to be drawn up, and you have to give at least 5 shots at a time. So this really puts some pressure on us, because we want to make sure that we have people ready and that we give it in a timely manner. We have to give it within a few hours of drawing that up. So that's why appointments and having a schedule is really, really important. The Moderna vaccine does not require to be frozen, but it does require the other steps as far as diluting. It is also preservative free. It comes in a vial with 10 doses. So for all of those clinics, we have to arrange and have 10 people on standby and be ready with a schedule to give those 10 doses. So there is a process involved. We are working through it. A couple other caveats. In Moore County, we have a very high population of elderly, in case y'all didn't know that. And we have a lot of people who are 75 and older. So at given about 500 of these shots a day, last week we gave 1,000. That only hit the very surface of our 75 and older. So about the time we were thinking we were getting a little bit of handle on us, they go to the 65 and older, and we're nowhere near getting finished with our 75 and older. So the health department is given about 200 to 300 a day. They're doing a really good job with this and getting those administered as well, working with certain practices, working with patients that don't have a physician, and they are scheduling that as well. So we are working together with them, trying to get that elderly population covered first. The long-term care facilities were covered differently, so we are not involved with that administration. So the Pfizer vaccine does require that you get a second shot after 21 days to reach that full effectiveness. The Moderna is 28 days. You do have to get the exact same med that you got the first time. So if you get the Pfizer the first dose, you have to get Pfizer the second time. They don't really know what will happen if you would mix those. So important to do that. It's also important to time those. There is some wiggle room in that. You can get it as much as 4 days early and several days later, but we're trying to get everybody kind of on a schedule. There was a question about going to just giving everybody first doses. The thought right now on that is that you're about 50 to 60% protected after the first dose and 2 weeks. And that eventually they may say you only need one dose. But our goal right now is to get the healthcare workers, high-risk population, and as much of the elderly folks as we can vaccinated with the 2 so that we have full protection at 90 to 95%. I feel like when they may, and this is just the Jane Lee opinion, Dr. Watt may have an opinion on this too, but I feel like when we get to the younger, healthier population, we may go to 1 dose. But right now, the recommendation and the clinical trials were all based on 2 doses. So what do we know? We're still learning a lot about this vaccine, as Dr. Watt pointed out. We think it's going to be very effective. We certainly think it will decrease your risk of being as sick with COVID as many of the people that we have seen now. They are publicizing that it is effective against the variants that Dr. Watt was talking about. And we hope this is our answer. As we talked about early on, we hope that we can improve the forecast of where we are and see 2021 as improving with continuing to wear a mask and take precautions and get the vaccine. I don't see mask wearing going away right away. So my story on double masking is if you have a real pretty one that somebody made from you, you wear it, your cloth pretty mask, but have a regular mask if you can get these underneath it. That's the only time I really recommend double masking is this mask and some, your Christmas mask or your Valentine's mask over the top of that if you want to look good. Cloth masks are good. There's nothing really, they do provide some level of protection. But, if you can wear either a disposable mask like this that you can throw away more quickly, or the KN95s that Dr. Watt was talking about, that's going to add an extra level of protection. What we've talked about from the very beginning of COVID is the most important person to have a mask on is the person who's sick. It's more important at keeping the person who's sick from spreading it to others. But of course, you don't necessarily know you're sick. And you don't know who is. So all of us wearing a mask and taking that precautions, both to protect ourselves and to protect others, is really important. And I think that's key, that masking and taking these precautions protects you, but it also protects others. And when we talk about taking the vaccine, somebody asked, I'm 74 and I'm healthy. I think that was the age. Yeah, I don't have any medical problems. Should I get the vaccine? Absolutely. When it's your turn to get the vaccine, get the vaccine. Because again, it's as much to protect everybody else. We all need to take the vaccine so that we can protect everybody in our community. It's not just about doing it for yourself, it's also doing it for others. So I think that I answered most of the questions that are between Dr. Watt and I, the questions that were in the chat room. I'll turn it back over to Peggy.
Okay. Thank you so much, Jane. Very helpful. Very, very helpful. We can open it back up for 1 or 2 more questions in the chat if somebody else has, or if Rob or Tony has thought of something else that they want to add.
Can I say something about the vaccine also? There was a couple of questions in the chat room. Can the vaccine prevent us from getting virus or just diminish symptoms of the virus? Can we still pass the virus to others? And the answer, as best we know it, is yes, indeed. The vaccine clearly prevents you from going on to severe disease. If you add Moderna and Pfizer's data together, they only had 1 out of 32,000 people develop severe COVID disease. So is it 100%? No, it's not 100%, but only 1 out of 32,000 in the 2 trials together developed severe COVID-19. So you need to get the vaccine, okay? However, I think Jane agrees with that.
Yes, I do. Yes, I do.
Number 2, I hate to say this because I'm pushing 70, Jane, but the #1 risk factor for bad outcomes with this virus is age. And I've talked to all the pulmonary guys that Jane and I know, and it has to do with respiratory reserve and the age-dependent decrease in respiratory reserve that we cannot all get away from. I mean, every year we lose a little bit of our respiratory capacity, and this virus is going to demand that you use every single alveoli in your lung that you can muster to stay oxygenated. So age is the #1 risk factor, and so you definitely should get the vaccine. There's another one about the variant. This is a very interesting thing about these variants. Just 1 minute on this. These viruses have very, very, very carefully evolved replication systems. But if you're making trillions and trillions of particles, imagine a machine that has 99.9999% reproductive, is efficient 99.99%. When you're making trillions of particles, you get variants, some of which we go away because they make the virus less likely to spread. So there's probably many, many, many variants that we never detect because the virus mutates in a way that is not to its advantage and it doesn't infect anybody and it dies. So by limiting the number of people who are diseased, you limit the replication cycles of the virus and you actually will help with development of variants. So, we need to get this pandemic under control so we can limit the number of people who have trillions and trillions of viruses in them and limit the number of variants that evolve. So it's very important from a public health standpoint to get this vaccine.
Yes. So couple things that have in the chat room. One, if you have had COVID, they are recommending that you get the vaccine. They say you can wait as long as 90 days because you have some natural immunity for 90 days. At first, they were saying you should wait 30 days after your infection. They're kind of wavering on that now, that you could do it sooner. But once you're recovered, feeling better over your symptoms, get the vaccine is important if you have had COVID, to go ahead and get vaccinated as well. So asking about time frames of when I think you can get the vaccine, like I said, in Moore County, one of the issues is that we've got a lot of older people and we're working our way through that. We're in the 80-year-olds now. So it's coming. If you're willing to wait a couple of weeks, just give us time. We'll get there. You'll get a call from your doctor. You'll get on the schedule. You'll have a good process. It'll go smoothly. If you are really anxious and you don't want to wait a couple more weeks, you can drive to Greensboro, to the Greensboro Coliseum and sit in a line. You can drive to Fayetteville and sit in a line. You can drive to Lee County and sit in a line. But we just chose, and because we don't have a big event center like a Greensboro Coliseum, we felt like we had to do this more organized and with appointments and with a schedule. And so I think we will be rolling this out. We hope to get plenty of vaccine from the state. We'll be doing, hopefully very soon, several thousand a week. That's our goal between us and the health department. Get your name on the list at the health department. Go ahead and call. It's 947-SHOT, S-H-O-T. Go ahead and call and get on their waiting list. Even if you're 65 or older, get on their list. If they call you first, go get it from them. If you get a call from your primary care, then you're on the list to go through the Fair Barn, take it. Get on whatever list you can like that. But I do think that the state is committed to getting the vaccine out. We are committed to doing it in a process, an organized fashion, and we'll get it done. Depending on your age, starting with the oldest and working our way down. But, it is coming. I said there's only two kinds of people that I talk to, people who want the vaccine and they want it right now. And I appreciate that, or people who don't want it at all. It's like there's no in between. But we are getting there. We hope you do all want it, and we want you to get it, and we want to get it out. And there are some avenues. And like I said, if you don't mind driving somewhere and sitting in a line, go right ahead. If you're willing to wait for us, I think, in the next few weeks, this is going to continue to build, and we're going to give absolutely every dose that we can, that we are allotted by the state and given. One of the other issues is they allotted the vaccine by the population in each county, not by the age of that population. So we're getting these based on Moore County's population, getting 1,000 doses a week, but we're not, the fact that we have a very high percentage of elderly population was not necessarily calculated into that. We are having conversations with the governor and Mandy Cohen about that, and our representatives are aware of that. We've had conversations here with Jamie Bowles and some others that are trying to help us with that as well, to get more allocated to this county. And as we get more allocation, we will be able to get that out. The health department will be giving vaccines 4 days a week at both the health department and the ag center. And then we'll be doing 2 to 3 days a week. That's still probably 2 days every week and maybe a third day on some weeks at the fair barn. But we have to work around the fair barn schedule. Here at the hospital, we're still only going to continue to give it to those that are healthcare providers or that invited here in some way to get it here, just because of our limited space and parking and everything else around the hospital. So that's why we're not going to be doing big mass vaccinations here at the hospital. Cape Fear Valley got a lot of vaccine. Fayetteville has a big population and not as old. If you want to drive to Fayetteville to get it, more power to you. Go right on. Because I think, and I heard that what they're doing at the Crown Coliseum is going pretty well. So take advantage of that, because they don't have that many people in that age. As Fayetteville overall has a higher population but less elderly. So you may be able to get in sooner there. It won't hurt our feelings.
Do you want,
I just wanted to say something, if that's okay.
Mhm.
I just wanted to give kudos to Jane, because my husband got the vaccine last week and he said he was so impressed with how everyone went. So I just wanted to give a thumbs up for that.
Thank you very much. Thank you. We appreciate that. We have heard good comments, and I think we have a really good process. It just takes time, and we're working through that.
well, we are so appreciative of your time today, but especially of what all three of you have done in this time of crisis that nobody asked for. And I know what kind of pressure it's put you under, and on behalf of the community as well as our behalf, we're just so grateful for everything that you have done and will continue to do, because it's not going to go away. And I'm assuming we should continue to wear our masks after we're vaccinated.
Absolutely.
Yes.
Yeah.
All right. Okay. Thank you so much. And if you have more questions, continue to put them in the chat, and we will get them to our guests and hopefully get some answers for you. But
Can I just put one that is in the chat? Is there a chance that we could ask Mr. Price how we can help him serve his patients and families while we have you, Mr. Price?
Sure. Thanks for the question. Unfortunately, we have had to focus on healthcare here. We used to have food available for our patients. We used to have clothing and also medical supplies. We've had to close that down and just focus on medical. So for that reason, we don't have an understanding of what our patients really need beyond the healthcare. I am hoping to open that back up in the next week or so. And as I get information about needs, whether it be food, clothing, jobs, whatever the case may be, I'll be happy to reach back to your organization and share that requirement to you.
yeah, but donations are welcome. Monetary
Donations are always welcome.
Okay.
Absolutely.
Okay.
We have some storage facilities here, so if you have medical supplies that you'd like to donate to us, by all means, please share them with us. We will take pharmaceuticals that are expired, and what we do is we capture them and we take them to the police department just to save people. But yes, we're open to donations, and always financial support is welcome.
Good. Thank you. So, Joan?
I have to again reiterate my thanks to all three of you. Wow, tremendous information. And thank you to the people who joined in to get that information as well. I'd also, well, at this time, I'd also like to thank Peggy Crawford, who put this all together. As usual, Peggy always comes through for us. Thank you, Peggy, so much. Because this is really, really helpful for our understanding of everything going on. Right now, I'd like to go back to Jay, who's going to take on our regular meeting. So bye to you if you are leaving
Thank you.
now, because now we're going to have our business meeting.
Thank you, Rob. Thank
So
you,
much.
Tony.
You're welcome. Thank you.
Thanks, Joan. So, yeah, that was a really helpful and, it's such a hard time right now. So all the information we can get is so important. So we're going to go forward with updating our members on what's going on. And there's a lot going on. It seems like now that we're all home, everybody seems to have a lot of energy to help out, which is really wonderful. So I'm going to ask a couple of people to talk about some of the projects that they're working on and, try to keep it a little bit brief. We're an hour into the meeting already, and I know not everybody likes to sit in front of computers all afternoon. So first up, Janet Samuelson is going to talk about what's going to happen tomorrow. So Janet.
Thanks, Jane.
And be sure to remember to unmute and then remute yourselves. Thanks, Janet.
Our celebration of diversity and accomplishment takes place tomorrow on Inauguration Day, 6:30 p.m. to 7 p.m. virtually through Zoom. Please invite your friends and prospective lead members, as this also serves as a new member recruitment event. An email or an e-blast has already been sent with the Zoom link by our co-presidents, and another email blast with the Zoom link will be sent today. So let's toast women and all their accomplishments. See you then.
Thanks, Janet. We've been practicing, and hopefully, I think it's going to be, it's a short event, but I think it's going to be good. So I encourage everybody to try to sign in for that. Next up is Mary Lou Burnett. So as you know, March is coming up, Lunch with Legends, and we're still doing it. So Mary Lou, you want to talk about that for a couple of minutes?
We are still doing it. We're doing a virtual Legends. And as I said in the newsletter, we are focusing on lunch more than the Legends this year. What we're going to do, and I don't know who they'll be yet because we had a very limited tapes. We only have 2 years of having had the program taped, our first presentation and our third. And we don't know yet. We've had to send those tapes out to have them changed over to digital files. So as soon as we get those back, Tom and I'll take a look at them and see what we think makes the best presentation, and we'll do 2 of them. I think it'll be fun for those that were around in 2009 when we had our inaugural event. And hopefully we have so many new members that weren't here then. And so this should be new presentations for them. Our lunch is going to be handled. That's going to be the donation. That's where we're going to have our income. And that will be Rose Powers and Shirley Sanderson are working with the Women's Exchange, and they're going to provide the box lunches. I don't have any details yet. They're closed. They're not going to open, I don't think, for a couple more weeks. And when they do, then they'll pull together the details and we'll come up with a price. But I'm going to think it's probably around $20 to $25. It is also March 16th. We have the same date that we had. So all I can say is save the date. Tell everybody you know. I'm trying to get a hold of a list from our last year's customers, and everybody on there who are not members of the league will be personally contacted so that they know that we're doing it. It's important to keep this alive and well so people don't move on to other things and we lose them next year, because surely by next year we can do another one. So that's about all I have right now. I'll just have more details for everybody in February.
Ann Torok is next. She's going to talk a little bit about fair districts. And don't forget to unmute.
Okay, hi. I'm trying to reorganize our Fair District Action Team, and I'll give you 3 sentences about what Fair Districts is all about. The census counts should be available soon, probably this year, and by law, each state must redistrict based on the new counts, so it's a must. And our state has grown in population. We're talking about possibly new seats for the representatives. Fair districts is the word we're using in North Carolina. It's the opposite of gerrymandering. I won't go into the whole thing what gerrymandering is. But I am trying to re-energize a committee. I'm going to do a Zoom. I have a handful of people that have expressed that they are interested. If you are also interested, I just typed my name for the chat box and my email address if you're interested. We're going to do a Zoom next week, and I'm contacting the people who are interested to see what day is best for people. So if you're interested, contact me or leave your name in the chat box for me, and so we're going to have that meeting and see what we as league members can do to help draw fair districting. Okay.
And the fair districting is really, really important, as we all know. North Carolina hasn't been great on that, so hopefully we can do a better job. Okay, I think another league action team that's trying to get a little bit re-energized is the healthcare one, which is obviously, as we just spent the last hour talking about, very important. Tina Gannis, are you here?
I am. Are you ready for my report?
Yes. Yep.
We are indeed being re-energized, and I hope that this presentation today kind of lights a fire under a couple people and has them express some interest in joining our HCLAT. I feel like at the top, we need to be re-energized with the executive branch. As we start with inauguration and new secretaries of health being installed and so on. I just this morning read in my news feed that Dr. Rachel Levine is going to be installed as, is nominated at least for Assistant Health Secretary. She was the health secretary in Pennsylvania, where I hail from, and is a personal friend. So Dr. Rachel Levine, look for that in the news. I reached out to the National League for some direction, and I hooked up with Karen Bean, who is from Charlotte, to give us an idea where we're going as an HCLAT nationally and statewise. So we met poolside with my intrepid committee, Bonnie Matthews, Lorna Clark Rubin, Mary Lou Burnett, and just sort of brainstormed back in the fall. And so we're thinking national, state, and local. Locally, we are going to be energized by whatever members we have who are interested in local issues. So please reach out. I will put my contact information in the chat room as well. And that's all I have.
Hey, if I can just mention in the chat room initially, Holly Powell, who is also interested in being on health, put in information on to study COVID-19, download C19 app by Zoe. It sounds interesting. Maybe we can hear more from Holly about that and put that thing that we can contact or utilize for COVID as well. Thank you, Chris. Thanks, Tina. Jay, it's yours.
Okay. Okay. Next up then is Agnes Gioconda, who is joining us. I hope. Are you still here, Agnes? Because she wasn't feeling well. Good. Good. She's joining us from Cabo San Lucas right now. And she's going to talk about our really exciting project, Dynamic Dialogues on Democracy.
Well, it's really coming together nicely. We're very excited. We've been in touch with Ben Denton, who is he's the debate coach over at Pinecrest High School, and he is very excited about our project. Says that his debate team is well versed in the 3 issues that we are interested in covering, And so Kelly Hardy and I will be meeting with him to kind of hash out exactly what the format will be. We're picturing not so much a formalized high school debate approach, but more of a, you know, a little bit of background to start, and then some back and forth dialogue, and then maybe some summary. So we are focusing on 3 topics. The first one, and you'll be happy to hear, and we will get in touch with you and work with you on this, is going to be on fair districts. We've also been in touch with Jennifer Bremer, who is the state absolute expert on the topic, and we will be, she's interested in getting involved with us. So look for a specific date in early April for our first dynamic dialogue on democracy. And then we will hold 2 more. One will be about the Electoral College, which will probably not be until November. And then one in September we'll hold around Constitution Week, which will be on how amendments get made to the US Constitution. And we will highlight some key ones, probably the 14th and the ERA. So if anyone is interested in getting involved with this working committee, I'd be happy to have your information. Thank you.
It's going to be cool. It's going to be cool to work with the kids, I think, too. So we have a little bit of a change to the agenda when I originally set out. So Terry Watt is going to talk about women's reproductive rights and what her committee is doing.
Thank you, Jay. And thanks to the co-presidents for putting this into the meeting so that we can basically share with the membership what we're doing in these various committees that I think is important. I'm going to share my screen. This is going to take less than 5 minutes, but I just wanted people to see. This is what the Women's Reproductive Rights Committee is focused on and committed to. The decision whether or not to bear a child is central to a woman's life, to her well-being and her dignity, and to her contribution to society. Ruth Bader Ginsburg with a little input from Terry Watt. Reproductive rights include the following: the right to birth control, which because more and more companies are refusing to help, especially our poor section of society, becoming a real problem. The right to access good quality reproductive health care, no matter your financial standing. The right to educate and access in order to make free and informed reproductive choices. The right to receive education about contraception and sexually transmitted infections. We need a lot to do with education in this country. And the right to safe and legal abortions, because there is never going to be a time when you're not going to have abortions. It's just now that they're safe. Reproductive health and rights are under attack like never before. The mission of the Women's Reproductive Rights Committee is as follows. The committee collects and vets evidence-based women's reproductive rights facts and then puts them out to the League of Women Voters Moore County group. These facts will also allow the League of Women Voter Moore County group to relate the issues intelligently to the outside world. From the newsletter, which I do put together, and I'm always interested in information you want in there. From the newsletter, you can see that this month we are following the hearings by the House Appropriations Committee to continue to okay the Hyde Amendment. The Hyde Amendment restricts federal funding from supporting abortions except in instances of rape, incest, or to save the life of the mother. The amendment effectively bars federal Medicaid funds from being used for abortion except for instances in which the woman's life would be endangered. As far as I'm concerned, this is purely a racist piece of law. And this woman here agrees with me. The impact of all these restrictions is on poor women, because women who have means, if their state doesn't provide access, can find another state that does. I think that the country will wake up and see that it can never go back to abortions just for women who can afford to travel. So our group has been studying and following the hearings on the Hyde Amendment and translating to you what this means. And if you are interested in women's rights or human rights, please contact myself or Ginger Mincello. We are the co-chairs and we would love to welcome you to our group. Thank you.
Thanks, Terry. And there's actually going to be a meeting of that group. Joan will probably talk about this, but it is going to be on the 28th at 4 o'clock in the afternoon. So it's a pretty good group. And Terry and Ginger have had some speakers and things. The next thing that was also not on the agenda that I wanted to talk about is the ERA. I've been getting tons and tons of emails and even a couple of phone calls recently over the last day or so from the North Carolina Alliance for the Equal Rights Amendment, of which the League is a very strong member. And they're gearing up for some grassroots activity to lobby the new Congress to lift the purely arbitrary restriction date for the ratification of the Equal Rights Amendment. So if you're interested in this, our league in Moore County needs to have someone to act as the liaison to the North Carolina, sorry, I can't talk today, North Carolina ERA Alliance. So if you have any kind of interest in this, you can contact Joan or myself. They've got a lot of activity going on right now. I think you're probably going to see some things in email about that too.
Okay, Jay, can I also add, along with hearing from ERA at the state level, we've now been hearing from Immigration Committee at the state level, which we do not have a committee on that. But again, because of the inauguration and the new emphasis on immigration, and maybe one of the first things that's going to be addressed, they're sort of suggesting that maybe we as a league can start taking a look at immigration as well. We did have that committee about 2 years ago and actually had an excellent speaker on it. So again, we have so many opportunities for people to volunteer. So if it's in your wheelhouse and you want to do it, let us know. Thanks, Jay.
Thank you. Thanks, Joan. Yeah, things are popping up, minute by minute around here. So the last thing I really wanted to talk about is the communications, because we, especially in this time where we're not meeting together in person, communication is really so important. And we do the newsletter. As Terry mentioned, she is the editor of the newsletter and pulls it all together, which is great. She does a great job every month. But we need input from all of these various groups to make it really worthwhile. The other thing, if you haven't looked at the website, LWVMC.org, check it out. It's been rejuvenated thanks to Peggy Crawford over the last couple months, and it's really good. But we do need somebody who's interested and has the skills maybe in any kind of website things to make sure it's updated on a regular basis, so that nothing worse than going to a website and seeing things that are 6 or 8 months old. So we want to make sure that that's a living website and is continually updated. We do have a Facebook page or Facebook group or Facebook. I'm not even sure what the right terminology is for it, but we do have a Facebook thing. And but we don't have anybody who's really, really knowledgeable about Facebook and the ins and outs of how to use it. In addition to other social media, we'd love to have a bigger social media presence, but we just don't have anybody who's knowledgeable about that. So if you have any kind of energy around that, please let Joan or myself know. And I think that's it for most of the business part of the meeting.
Jay?
Yes, go ahead,
Peggy. Can
Peggy.
you mention the Ruth Polly lecture? Wilma.
It's coming up. It's coming up.
We're not done yet.
We're not done.
Okay, sorry.
Yeah, I was just going to turn it back over to Joan to talk about upcoming events.
I'm doing the upcoming events, and Ruth Polly Lecture Series is coming up on January 21st. So that's this week at 7:30. And it will be Linda Carter, who's and the title is Uber Marathon Runner which intrigued me. So I kind of looked her up, and she is intriguing. 7 marathons, 7 days on 7 continents. This is a woman, and she has type 1 diabetes, but she's also has taken part in the World Marathon Challenge. And this blows my mind because I'm trying to be more physically fit myself, but she's run 183 miles in 168 hours. I can't, 183 miles is just phenomenal. And she's planning to do it again. So our whole inauguration event is about strong women. She exemplifies strong women. So if you get a chance, tune in to the Ruth Bali lecture series, or you can do it after the fact because they're then on their website, which I have done in the past, if you can't do it that night. Inauguration event, please, as Jay said, we've practiced, and I think we have it together. It's going to be great. It's short. It's from 6:30 to 7. I did hear this morning at 5:30 there's a special event on the inauguration schedule, but it should be over by then. So either before your dinner or after dinner, join us for that toast, because we're so proud of women, strong women everywhere.
And be sure that when you join us that you have in hand a beverage of your choice, adult or otherwise.
Preferably that adult one. No, that's okay, whatever. Okay, and then as Terry said, there will be a women's reproductive rights meeting. It's January 28th at 4 o'clock. Again, if you're interested, join. We're finding that having these meetings like we are right now on Zoom almost makes it more easier for people to listen, and then also if they want to contribute. And it's women's reproductive rights, but it's really women's rights altogether. And I think we're, again, with this new administration, that's going to be in the forefront. So very important for us to make sure we participate. And then, of course, next month, we'll be here before you know it. We'll have our board meeting on Tuesday, February 2nd at 9:30. And our next general meeting is on February 16th. And that meeting will highlight local businesses. And I'm not sure of all the details. I think it's still being planned, but it sounds exciting, as we're particularly going to highlight women in business and address some of the things that they've had to go through with COVID. Because again, we heard so much today, but some of the implications of COVID have been really, really devastating. So it will be exciting to hear from local business people and what they're doing right now here in Moore County. So it's another one that's focused on our local community. So again, you can look forward to that next month. I just have to make a comment. I've been trying to follow. We had over 50 participants again, which isn't great, but it's better than we've done in some of our meetings in the past. And again, I'm just overwhelmed with all the information we got today, and correct, truthful information. I have to say, I already got my first shot here at Belmead. We did it with Moderna. We did it through CVS. We didn't do it with the health department or the hospital. Again, both places, because I know people that have had it in both places, the organization and the way they do it is just so safe and just so easy. Because when you look at some of these places where people wait in mile-long lines, nothing like that. Plus the idea of making sure afterwards you do stay for 15 minutes. And as a person who who never knows when she's going to have an allergic reaction, that's important. You feel so much better because you know that they're making sure that your body's accepting that vaccine. So again, Peggy, you're wonderful. Thank you for setting that up. I think it was an extraordinary presentation. And Jay, I think we taped it, so it will be edited and put up on our website. So again, thanks for everyone for coming in. Thank you for being such an active part of the league.
Thanks,
That's it.
everybody.
Thank you.
Have a good month, and we will see you in February.